Cancer is the world's second leading cause of death, responsible for 1 in 6 deaths each year.
It's a devastating disease that touches many people's lives.
We know that the best way of improving someone's chances of surviving cancer is to diagnose it early.
Yet current tests that screen for cancer are often invasive and unpleasant.
It can be expensive, and some tend to only identify late stages of cancer.
These factors mean that many people are not being tested and receiving that all-important early diagnosis.
Our mission is simple. We want to save lives.
We're developing easy-to-use, routine blood tests that help screen for cancer.
With this, we aim to revolutionise the way cancer and other diseases are diagnosed.
Volition is one of the leading epigenetics companies and is listed on the New York Stock Exchange. We're very fortunate to have attracted numerous long-term shareholders to our company who share the same vision of revolutionising cancer diagnostics, helping people find cancer earlier in order to improve outcomes for millions of people worldwide.
Our lab is situated in a science park in the Walloon region of Belgium, close to the beautiful city of Nu.Q. The building itself is a generous 20,000 square foot facility with a large purpose-built laboratory, automated rooms and biobank, and we still have room to grow. We now have a staff of over 30, including biostatistician and a clinical validation expert, working on the development of our Nu.Q platform. Our biobank holds over 70,000 samples, and our laboratory has bench space for up to 25 lab technicians, and many automates, including our new IDS machine and the first Lumière to be operating outside of China.
We also have offices in London and Singapore and are headquartered in Austin, Texas, which is also home to Volition Veterinary.
Our worldwide portfolio of granted patents is growing. Our strategy is to protect our technologies and leverage the strength of our intellectual portfolio to gain market exclusivity in Europe, the United States, and other key countries. The patents on the technologies underlying our products should provide broad coverage, including veterinary medicine application, and provide protection through at least 2031.
We're developing a range of blood assays of epigenetically altered circulating nucleosomes as biomarkers in cancer and other diseases, and we call these tests Nu.Q. Our Nu.Q products will be simple, low-cost, routine blood tests, and therefore should be accessible around the world.
The principle behind the mechanism we use to detect cancer involves really two very simple bits of biology. The chromosomes of cancer cells differ from those of healthy cells, both in terms of DNA sequence, but also in terms of protein structure due to epigenetic changes. When cells die, the chromosomes are essentially chopped up into their component parts, and the component parts are called nucleosomes, which are little balls of protein that occur along the string of DNA. In cancer, there are a lot of cell deaths, much more than normal tissue. And when a cancer cell dies, the nuclear components are metabolized into 20 million odd individual DNA nucleosome complexes. Our nucleomics technology exploits the different compositions of circulating nucleosome structures present in the blood of cancer patients to detect and identify cancer diseases. Using the nucleomics technology, we don't look at the 1 in a million, we look at all of them. And the second is that using Nu.Q capture, we can remove the healthy nucleosomes that form the background and look at those nucleosomes that come from the cancer.
The idea of Nu.Q capture is that we can enrich specifically the cancer-derived nucleosomes that are also containing that specifically mutated DNA. When chromosomes fragment as the cell dies, nucleosomes are released into circulation Some of those nucleosomes contain linker DNA, which links them together in the chromosome. And it's known from previous work that the cancer mutations are specifically associated with nucleosomes without linker DNA. So Nu.Q capture is designed to work by pulling out and removing the nucleosomes that still contain linker DNA. Once we've captured the nucleosomes, then we have an opportunity to analyse them in a number of different ways. So we can sequence the DNA, which is now enriched for the tumour-derived DNA, and we can use that for treatment selection or diagnosis. And finally, from our own perspective, most excitedly, we think because we're focusing now on tumour-derived nucleosomes, that it'll really enhance the sensitivity of our own Nu.Q assays for diagnosing different types of cancer using our nucleomics platform.
We believe Nu.Q will not only be helpful for human diagnostics, but for animal diagnostics. And we're working with Texas A&M University to develop a line of Nu.Q vet products to help disease diagnosis in the veterinary market.
We plan to develop Nu.Q products across a range of cancers, including frontline screening tests for the most common diseases. Tests that can be used to help identify high-risk subjects and help triage those who should go forward for more invasive and often more expensive tests. And tests to aid the diagnosis of disease in symptomatic patients. And finally, tests to help with treatment selection and monitoring, both treatment response and disease recurrence.
In 2018, there were over 18 million cancer diagnoses worldwide, resulting in over 10 million cancer deaths. Given the growing, and more importantly aging population, the burden of cancer is expected to worsen. By 2040, it is expected there will be over 29 million new cases of cancer diagnosed each year, resulting in 16 million cancer-related deaths per year. We're all working hard each and every day to reduce that burden. Our mission is simple. We want to help save lives. We are aiming to revolutionise the way cancer is diagnosed. And together, we're committed to solving early diagnosis of cancer.